So why is dementia important? If you think about it, just like heart failure, liver failure, renal failure, dementia should be thought of some form of brain failure, the inability to deal with things because of the brain failure. As a result of the degeneration condition, the reserves in the brain actually get depleted such that when you are diagnosed then with dementia, the cognition is actually overwhelmed. But unlike heart failure, liver failure, or kidney failure, in my opinion, this disease is more profoundly debilitating because it is inextricably linked the mind to the person. Brain failure increases exponentially with age and doubles once every 5 years, past the age of 65. So if you think about it, in our local robust study done at IMH, the prevalence of dementia at the age more than 60 is between 4.6 to 10%. So if I were to put it into an infographic type of manner, right? So when you are 65 to 74, if I throw a stone at 33 people, one will have dementia. But if I pushed it up for another 10 years, then you're talking about if there's a row of people of 6, I throw a stone, one may get dementia. And this, of course, goes up even more by the time you reach 85. So, as I mentioned, my grandparents, right, 3 of them, so in a row you throw a stone, without even examining them, one will have dementia. And this becomes very, very important because clearly we are an aging population, right? So as we age, the risk of this problem actually increases. But and the reason why we would actually want to deal with this is because even a delay of 5 years, there's significant benefit, both obviously clinically, disease-free life, but also economically. Study in US shows that up to the 5-year delay saves up to $500,000. So it's $100K every year. So that's why this, I think, is a very, very important topic. Now, what are the symptoms of dementia? Right? The symptoms of dementia. Dementia is categorized as a disease of cognitive impairment. And the latest diagnostic categories, you may hear it being labeled as a major neurocognitive disorder. The diagnosis of dementia is actually ultimately made clinically through an assessment. But of course, all the investigations are quite important to increase the reliability of the assessment, especially when the symptoms are early or if the symptoms are a bit weird. And that to a certain extent where I come in, because sometimes people label such things as psychotic, psychiatric illness. So you want to actually delineate one from the other. Okay, so dementia is actually categorized in this particular way. You know, people always talk about memory problems, but there are other domains that also need to be affected that you would then label as dementia. So things like complex attention, executive function, memory and language, perceptual and motor symptoms, social cognition. So you'll be looking out for these areas of impairment to make a diagnosis of dementia. Of course, it has to interfere with function. So you can, a lot of people say, I can't remember, but they still go out, handle money, they don't lose money. Not there yet. You wouldn't label someone like that with dementia. And of course, as I mentioned before, dementia is in part a diagnosis of exclusion. So you need to make sure you don't miss anything, whether it be a medical problem, psychiatric problem, pain, symptoms, so on and so forth. So that's the holistic type of evaluation and management of dementia. Dementia as a category comes in these few forms. But today we'll focus very much on Alzheimer's dementia, because if you can skin the big fish, you will deal with the rest. So if 70% we can deal with, that's already a big success. And the model for dementia Alzheimer's dementia will also then be the model for the treatment of other dementias. So just as a broad heading, the other types of dementias apart from Alzheimer's include that of vascular dementia, 10-20%, frontotemporal dementia, or 10%, and of course Parkinson's related type of dementias, about 4%. But today we have really focused very much on the Alzheimer's dementia. The mechanisms of Alzheimer's dementia are twofold. It's the accumulation of two proteins, the beta amyloid as well as the tau protein. So if I draw your attention to the right side of the slide, tau protein is really a protein in the cell of the organism that helps with transport. And in normal circumstances, they are actually okay. But when you grow old or when there's a disease process, they start to misfold and then accumulate within the cells. If I were to then ask you to focus on the left side of the cell, we are talking about amyloid plaques. So these are proteins within the cell membrane that when it's broken down will give you alpha and beta amyloid. So alpha A and alpha B. So alpha A is generally okay. It's soluble, it's easily dealt with. The problem is with alpha B, for which it's insoluble. In normal healthy people, it's actually cleared. Your cells will clear it and so on and so forth. But in dementia, that's when it starts accumulating and it forms amyloid plaques. So that's the basis for the disease. These are histological slides. May be interesting to the doctors, but for general purposes, this is what it looks like. So this shows amyloid plaques, and these actually show neurofibrillary tangles. Now, the accumulation of these plaques and proteins can be actually silently accumulating for 10 to 20 years before the onset of symptoms of dementia, which I mentioned before. So, truth be told, it could already be happening, but when the symptoms actually come on, then there's significant load in the brain. I will now use an analogy to help basically framework and to understand the strategies in therefore dealing with this particular illness. So if you imagine the brain as a factory, and for this purpose, you do not really know the internal health of the factory, whether there's corruption going on, but how we measure how the factory is functioning is through output. Right? So if the output seems okay, the factory seems okay, the company seems okay. At the micro level, the factory is made up of workers, right? So everyone here is putting hands together to produce the product for the factory. In a well-run factory, there are more than enough spare capacity such that the factory can continue maintaining output regardless of the internal stresses. So I can up, down, depending because I have reserve. Like in normal aging, even with a loss of a few of these cells, is like retirement, normal turnover, there is adequate reserve to maintain the production and therefore functioning. However, if the factory is not functioning well and layoffs, retrenchments gets more and more and more, soon even how hardworking you are, the reserves will be overwhelmed. And soon the production cannot be made because of the shrinking brain function or the shrinking function of the factory. So that's the analogy we would use. So ideally, there will be two prongs in which we will want to deal with this. Of course, one is to arrest the loss of cells, loss of factory workers. And these we are developing in terms of disease-modifying agents. Right? So ideally, we find something that can stop or even better reverse the progress of this condition. And it's there, it's almost there because we know the pathophysiology of dementia. But the other arm of research is to actually predict who will end up getting dementia. Because as mentioned, this process has gone on for 10, 15 years. You may want to catch it at the 10, 15 years prior to the onset of symptoms. So that's the holy grail. So based on these broad concepts, are there effective treatments here? Truth be told, it's coming soon. I think it's coming soon. I would like to think it's coming soon. But it may not be, truth be told, for my generation. I look young, but I'm actually 50. So if they actually it comes in the next 10 years, the 10-15 years of accumulation of amyloid plaques may have already happened in my brain. So we're talking about really the future, right? So two things. One is essentially how do we then predict family history, formal assessments, certain blood tests, and there can be a battery of tests. You do spinal fluid type of analysis, and of course neuroimaging, which Andrew will highlight later. Will one test be the answer? Most probably not, because dementia is such a varied condition, but you want to most probably put all these factors together to come up to predict and then treat. And of course, in the pipeline, there are already monoclonal antibodies that target amyloid to actually prevent the accumulation of this. So the future is bright, yeah, but you are not really there yet. So what is the present treatment of dementia? As mentioned, if you notice, a lot of it is in the exclusion of an underlying problem. And so a lot comes in terms of evaluating, because the underlying problems can be medical illnesses, can be psychiatric illnesses, can be other causes for distress, so on and so forth. So one of it is actually in the dealing and the assessment of that. The investigations, as mentioned, could be these. Quickly laid out their blood tests, check, make sure not the kidney, the liver, the heart, vitamins are sufficient, thyroid's not a problem, there's no infection going on. And in important cases, scans may be important to have. So just as a quick example, and I'm mindful of time, I had two patients that actually benefited from this type of early intervention. The first is, of course, my set of patients that have underlying psychological issues, but when the memory problems come on, you'll be worried whether or not it's part of a relapse of the condition or ongoing new memory problem. And that's where the evaluation, the scan, PET scans become quite quintessential for the assessment and peace of mind for the patient. The other, of course, is a very young man who actually has behavioral changes and a lot of issues coming on. Of course, no one thinks it's a psychiatric issue, so on and so forth. When the diagnosis is actually made, then things can move forward much clearer. So these are the ways in which we can actually help in terms of managing such cases. As for the anti-dementia medicine, there are a few classes at this point in time, but do not target the underlying psychopathology. What they effectively do is make the brain, or if I go back to the analogy of the factory, the workers work harder. So as the workers work harder, they try to maintain the function. But you realize that after a certain point in time, they may not be able to maintain the function. So just some, after all, I'm a professor, so we should go through some of these slides of results. So what I will want to show you is the improvement with the present treatment of dementia medications. I'm going to orientate you to the slides so that you will sort of understand this. So these curves are actually called Kaplan-Meier or the survival curves. In other words, they are watching how the disease progresses with time. If you look at the y-axis, they will measure the factors or the outcomes that you want to see. So in other words, usually they'll measure the outcome is death passing away, and that's why it's called survival curves. But of course, in this particular case, you can measure other things. And in this particular graph, it shows time to nursing home. So the outcome is nursing home. And of course, x-axis is the time as time goes on. So the curves describe various interventions over time, and usually there's a control arm. In other words, nothing is done. So in this particular case, nothing is done, meaning no medicine is given, is the curve below. And with the medicine, is the curve above. So you notice there's a separation between the two curves. There's a separation between the two curves. And the benefits conferred by the intervention will be the area under the curve. Right, so clearly, with medication, the time to go into a nursing home is delayed, right? And it is a surrogate marker of improved function, improved cognition, improved ability to cope with the patient before you say it's too bad, too late, and you have to go to a nursing home. The rest of the curves are very similar. So other studies have shown on the left side, cognition, meaning memory and function, and the other side in terms of activities of daily living, how they do behaving, feeding, changing, and similarly there's a spread, a separation of these two curves, showing that even with the present medication, it actually delays and confers benefit to a certain extent. And the last, most recent study, of course, also shows in various domains. In this particular case, the y-axis measuring cognition, measuring function, measuring behavior, measuring the overall global clinical status. It shows from the curves there's a separation, of course, of different degrees. I would like to highlight some early benefits. So if you look at the cognition, this surprising curve actually goes up before it comes down. So the initial starting of the medicine may show some benefit, but as explained, it will not be prolonged. So it's almost as if I suddenly give you a boost to be more efficient, you function better, but then it comes down. Right? So that's with cognition with the MMSE scores, the memory scores. Function, clearly not as robust in terms of the improvement. Behavior, again, there's an initial bump of a year or so before it comes down. And of course, when you add all this together, the numbers are like that. As explained before, if the numbers are too few, eventually it will also decline. And that results where the curve will meet at some point in time. The last part I would like to highlight in my talk is really to focus on the psychosocial preparation as well as the role of the generalist or the family physician. I personally think, even though I'm a specialist, that there's a big role, not for a general practitioner, but really for a family physician. I'm a bit of a movie buff, so if you know this movie, right, it's Logan. Released in 2013, the movie comes to mind when I speak on this topic. The third, last, and the best, in my opinion, of the Wolverine trilogy is this movie, Logan. So if you're all free in the afternoon later, maybe go and Netflix or something and you can watch the movie. The plot revolves around the theme that even superheroes grow old. So the movie explores the topic of aging, decline, and even death, right? Physical decline in Logan, who is Wolverine, and then of course cognitive decline in Charles, who is Dr. X. Right? So it's a poignant reminder for us of memento mori, which means remember your mortality. The arc of human progress results in people living longer. Modern medicine, therefore, more and more takes on people with chronic illnesses and disease of aging. As such, the old adage, and this is said by Hippocrates many years ago, is equally important now. Curatio, or cure sometimes. Tractare, which means treat often, but consolere, comfort always. So that's where I think, to a certain extent, treatment is broader than just finding the cure, but really how you actually manage this particular condition. Last slide. Therefore, I envisage that the doctor, the family physician, will actually end up being the guide in this disease process. And then, of course, in holistic care, you're talking about lasting power of attorney, about advanced care planning, and so on and so forth. So with that, I am ending the talk. We will get some Q&A at the end of the talk. Thank you for your attention.